Hi, welcome everybody. It's me, Dr. Khaled Sadek, and you're watching my fantastic YouTube channel on cysts and lipoma removal. Today, I'm going to be doing a live chat ahead of our premiere. We're going to be releasing a new video straight after this live chat, so be prepared for that. If you're new to the channel, welcome. I specialize in the removal of cysts and lipomas, and you can access all of our work at lipomacyst.com. If you see anything in the videos where you feel you'd like to take some medical advice, then please don't hesitate to contact us through lipomacyst.com. Our email address is contact@lipomacyst.com. I hope everybody is well and safe in this current corona climate, and I welcome everybody to this live chat session. So like I said, we're going to be doing a live chat, and straight away after this video, we're going to be releasing a premiere of a brand new pop. Fantastic little intro in the garden, so hopefully you'll enjoy that. We'll be taking some questions from our audience as well, so we'll be loving some questions, so fire away. And a recap of how we've been so far here in London. We've been working, our NHS clinic has been working. We're doing a lot of consultations remotely with corona patients, with heart disease patients, with diabetics and mental health. So our clinic is running perfectly fine on the NHS front. We're winding down the minor surgery stuff until the COVID-19 restrictions are lifted. So we're just purely focusing on the core service of our work. We continue to do that, and a lot of our consultations are done remotely. So you may also have this set up wherever you are in the world, whether it be in the States or in the United Kingdom or across Europe. You find a lot of people are now having their consultations with the doctor over the internet, a bit like what we're doing right now. So if you've got questions, fire away. But of course, always consult your local medical practitioner, wherever you are. And so, like I said, there's going to be a video straight after this. And tomorrow, on Saturday, we're going to be doing a commenting on the comments. So if you put your comments in the comments down below on this one, or on the premiere release of the video that's going to be released very, very shortly, we're going to incorporate that in our coming video on the comments. We've still got to get around to releasing the 100,000 subscriber YouTube. We can have a two-way discussion. We can bring up your video and my video, and we can have a live discussion, and everybody can join in that respect. So I hope everybody's well. Like I said, there's going to be a video straight after this video. Remember to watch that as well and comment down below, and let's take some questions from the audience. This is who we've got in the house today. Just a quick hello. I want to make sure everyone is safe and well given the coronavirus. Caroline, welcome. We've got Sandra, good afternoon. We've got Dr. Sarah, how are you doing? We've got Jean, hope everything is going well. Florida, USA, I think the weather in Florida must be amazing. Lisa says hello. Gail from Texas, welcome. And we've got Jill, hello Jill, how are you doing? Hope you're well. Norfolk, brilliant. I heard you're all corona free and living well. And the weather today was absolutely stonking, so I'm hoping you're safe and well. Kim from USA NC, welcome. We've got K8 Russell from California. We've got Dina, hello. We've got Ellie Mumford, hello. That's from Illinois, USA. We've got Denise from Edmond, Washington. We've got Gail from Rhode Island. How are you doing? We've got Sharon from Virginia. We've got Just Jen, welcome. We've got Kristen Rutherford, glad you're all safe in lockdown. We are level 3 moving to level 2 in New Zealand. Fantastic, it's so good to hear that countries are making that shift out of total lockdown, to be able to get out there, do some exercise, maybe see some family, get out there and stay well. Next one up, Bridget, how are you doing? Hope you're well. Happy Friday to you too. Debbie, so I'm from Nancy, USA. Fantastic. Will you be able to be vaccinated with COVID-19 vaccine? Well, hopefully once it is made, we should be able to produce a vaccine, and that should hopefully be the end. Fingers crossed, but we'll see what kind of vaccine comes out. Karen Brown, what are the symptoms of a cyst other than a big bump on your head? The doctors in Utah just dismiss people. Well, cysts can present in a number of ways. Often, they kind of just grow on your back and you don't even know they're there. The only reason people know they're there is when they become painful. And that means it's probably become infected, or it's showing through a garment, so a shirt, or a dress, or it's somewhere very, very visible and someone goes, what is that? It's pretty obvious it's there. So people pointing it out, your clothes pointing up, or it becomes infected. Those are the cardinal signs for it. Ruth, how are you doing? Karen, how are you doing? Dina from USA, how are you doing? Pat Schindler asks, why did you give up the initial practice delivering babies and female operations? Because I just found delivering cysts was so much fun, Pat. That's, who can argue with that? Next question. Lorena, hello, how are you doing? Kay Russell from All Nuts in California. Tell me, why is it nuts in California? Mrs. Bash, how are you doing? Caroline, this is becoming more like University Challenge. Well, I don't mind. You fire the questions, I will answer them. We've got 10, 15 minutes before we go live with our premiere for the next video for this week. But I thought, why not? We'll do a live chat. So let's have a look. Liam, hello from Dublin. Fantastic. Lovely to see Ireland being represented. I did a conference once in Ireland. It's a lovely city. I went to the Guinness factory and all across the river. Love the pubs there. Kim, how are you doing from Tennessee? Madeline from Dallas, Texas. What's the weather like in Texas? Lorena, great. We've got Leslie from South Africa. Where in South Africa? Tell me. Is it Jayburg? Where are you? Tell me. Just Jen is from Ohio. We've got a US of A. Still under quarantine here. I don't personally know anyone who has COVID, and I'm working from home and it's fine. I think that is the future. The new normal is for people to work from home. So we'll see how that pans out for everyone. Dina is from Vermont. Pat says, Green Bay, Wisconsin says, hello, Pat. Thank you so much. Virginia from Florida, Virginia Alvarez, how are you doing? Sula Lally, welcome on board. Hello from London, fantastic. And we've got Italy, we've got Lorena Minozzo from Italy. She's got her fingers crossed, Italy. You are, coming out of the worst of it, which is brilliant. Karen, we've had street parties where I live today. Well, it's VE Day. So today marks the 75th anniversary, end of the Second World War, momentous day, and very poignant that it should happen in the midst of a lockdown for this global pandemic. We've got global pandemic. We've got 75 years of the end of the global war, the Second World War. And so there are festivities. There's some bunting. There's a couple of barbecues. There's a couple of loud music and here in the gardens, which is great. People got to live. We've got to rejoice. We've got to keep going. The streets might be empty, but as the Queen said, they are full of love. So Carl either says, I think they're talking together there. Question 1, that's from Caroline. Will C19 make a difference to health and house insurance? Potentially, I think. But that'll have to pan out, whether or not pandemics are going to be covered in home insurance. Is your life policy going to include pandemics of all descriptions? We'll have to see what happens. Is it true that COVID gives some dermatological rashes? That's from Lorena. Absolutely. We don't know a lot about COVID, and we're kind of knowing it slowly. And something that is really coming up is what we call the subcutaneous manifestations of COVID-19. And by that, we mean skin manifestations, so rashes. And two main skin rashes are really coming up. One is called COVID toe. Got to make sure I say that correctly. I don't want to make any mistakes. So COVID toe has got basically like a frostbite, like a chilblain bruise on the toes and the side of the foot. The toes get swollen. They're very painful and a bit stiff. I've had a lot of patients come in with COVID toes. It looks like frostbite. You got to be careful. It's not like a fracture. It's not an infection. And what it is little blood vessels that hemorrhage and just bleed out and they clot. So clotting is a big issue with COVID-19 as a side effect. The second particular manifestation is like a maculopapular rash. So they get like this viral rash as well. Rusty, how are you doing? Welcome. Mrs. Bash says, Dr. Sadek, want to thank you for your advice you gave me last time because my daughter's eczema is coming up. Mrs. Bash, that is fantastic. Fantastic to hear. Rusty says they're saying TGE virus gives children red rash. The kids and red rashes and viruses is very common because their kidneys aren't fully functioning. They can't excrete them in the urine. That's where most of the adults excrete the virus. So it just seeps out into the skin. We see it in every single viral rash for kids. Always has a skin rash of some sort. Sandra from Ohio, USA. Debbie says, what is your favorite pop to do? Lipomas, comedones, etc. Ooh, I like a good pilocyst or sebaceous cyst or lipoma or blackhead. In fact, I like them all. I'm greedy. Okay, Archie girl, I love your videos, both the popping and the traveling. We haven't done much traveling because of the COVID-19. So the intro for the next, who's next? So Tracy from Iowa, Rusty from Rhode Island as usual. Welcome, Rusty. Gene, what is the best cream for psoriasis? Okay, so psoriasis, you got two creams. One is a vitamin D analog, and the other one is a steroid. And you alternate 1 month on the vitamin D, 1 month on the steroid. You've also got a coal tar ointment on there as well. So those are the two. Actually, there's three there, isn't there? The three. Jeff Hall, how are you doing? How are you doing? Fantastic. Kate says hello from Florida. Leslie from Massachusetts. We're still seeing high numbers of deaths and still only essential businesses only. Haven't decided yet when they're going to set anything up and running still. Well, the thing is, once you go through the exponential curve, you end up having this plateau where, we're not out of the danger zone, and you have to wait until you kind of go through the peak, then go through the plateau, then go on the descent, and that whole process will probably take 2-3 months. I'm probably looking for the easing of the lockdown probably in October, yeah, before we can have the good old days. Sulilali, Dr. Sadek, can we wash the place where the cyst was removed after, and how long? Very good question. So after all the surgery, recommend keep it dry. Keep it dry for at least 3 days. The stitches I put on are going to come out in 7 to 10 days. I mean, if you can just keep the waterproof dressing on for the whole 7 to 10 days, even better. But keep it dry because the body has to heal. Mother Nature has to scab over. It's got that waterproof natural plug, and we don't want it being washed away and opening up, gets infected, takes longer to heal, and there's scarring. So just keep it as dry as you can. Dry. But don't get it soggy. I don't want it soggy because that's bad as well. Okay. Mrs. Shah says, Wassalamas from Pakistan. Wow, fantastic. I'm a second year MBBS. Welcome, medical students. I'd love to become a dermatologist. Can you give me some quick tips? Okay, so tip number 1, get through MBS. And while you're doing it, do lots of projects on dermatology. Attach yourself to dermatologists, write papers about dermatology, go to clinics in dermatology, but also expand your mind. Look at everything else that's out there. So we're wishing you all the best, Wajiha, for finishing med school. The beer, she's from Mokopane in Limpopo. I think that was a South African location, and it's 300 kilometers from Joburg up north. That's fantastic. I would love to go. I've never been to South Africa, so I'd love to go. Hadi says, yo, we're British. How you doing? You good? Liam, in your opinion, what's the best and most innovative surgery for deep acne scars? I've tried everything. So deep acne scars, I will probably go with laser therapy. Just lasering the top layer, get the skin to rejuvenate again. If they're really deep, you can, it depends whether they're sort of a crater, or whether they're kind of puckered out like that. So if they're puckered, I recommend doing like a steroid injection, or doing a laser treatment. Okay, so let's skip through. So I won't take any more questions on this sitting. We'll do it again. Straight after the live premiere video. So if you've got questions, we'll do it after that. So enjoy the video, everybody. Take care. Bye bye.